2 minutes, we'll check again the pulse.
Chest tube is in place. Do you want me to put another one on the other side?
Yes, please.
Second chest tube, please.
Yes, that's it.
So second chest tube
Okay.
is in place.
Yes.
We auscultated the heart. There was no signs of tamponade. We ruled out pneumothorax. Now we are giving back his volume. If the 1 liter finished, we'll give another 500 normal saline.
Okay.
I can't hear.
Okay.
Because
2 minutes.
continue.
2 minutes passed. Hold still. Awaiting the investigations.
Two minutes fast.
That's yes.
2 minutes passed. Okay,
Yes.
let's check for the pulse. Prepare for CPR, please. Okay.
Saturation is
Start
improving.
CPR.
Okay.
Switch with you.
Start
I
CPR.
can-
No,
Give
it's okay,
another,
it's okay.
another 1 milligram of adrenaline.
Yes, doctor.
Please push hard.
1 milligram adrenaline given.
I want 2 inches compressions, please. Surgeon, of course, we deflate the organ.
Yep. Yes.
Yes, 2 minutes pass.
Pass.
Yes.
Check for a pulse. Okay, I'm feeling a pulse. We are having a host here. Please, if you can finish quickly, or if you can close, so we.
Shall I continue?
So if you can close the patient, we will shift the patient to the ICU. We'll start hypothermia, and meanwhile we'll take the tryptase to check if the patient had the true anaphylaxis, okay, or this patient is having another
Dr.
dose.
Fahad.
All right.
Saturation is
Okay,
going
that's
down
it. Thank you very much. That's the end of the scenario. Well done everybody. So just move down to the hall downstairs and we'll follow you shortly to give you the feedback. Thank you very much. Well done.
I don't know. We'll wait for the judge. We need to wait for the judge. We don't know what's the answer here. Can Mubarak people move to the middle, please? We'll wait for the judges. The judges here. Okay.
Good evening. So the time, the time. Good evening. Well, let us emphasize a point. Can you hear me? Let's emphasize this point. I think our boys and girls that came forward yesterday and today, and who are going to come in tomorrow, are, the bravest among all of us to come and volunteer to practice in front of everybody. So that's, nice of you, and we thank you for that. Many of us, would surely do worse than this. So, okay. And somebody here is pressurizing me. Somebody here is pressurizing me to know the result. Actually, both groups did very well, but Amiri had won. I was not thinking kifaya upstairs. When I was grading and all, I was not thinking kifaya at all. And you can see this now. I'm not thinking.
Yeah, I would like to congratulate both groups. They did excellent. And they were organized, clear-minded, and they took care of the scenario in a very professional way. Just one small comment. For some reason, everybody thought there was an pneumothorax and kept pushing tubes in the chest for no reason. I don't know why. But besides that, it was very excellent performance. Thank you.
Congratulations to Amiri Hospital. Although it was my opinion, Mubarak did better. But since two of them went with Amiri, actually, both groups were excellent, but I have a comment to Amiri group who won. They did some red flags. They couldn't recognize that the antibiotic should be stopped. They didn't communicate with the surgeon at all. This is my points regarding this. And both groups didn't recognize that there is pulseless electrical activity. They didn't check the pulse, I mean. Both, in this case, Amiri and Mubarak did the same mistake. Congratulations again to Amiri.
I mean, in general, as Dr. Boker mentioned this morning, simulation needs training, and we need to get used to using the mannequin and get used to doing things in a slightly different way than real life. And it shows that because both groups made the same kind of behaviors, if you want to call them, rather than mistakes. You know, both of them didn't check the pulse. While in real life, you would know if somebody arrests, you will see that they are dead in front of you, and therefore you will go and check a pulse. Okay, this patient, you know, we're trying to get as close as possible to the real life, but it does need a lot of training on the simulation itself, and it will get better and better with more and more scenarios. I think both of you did extremely well. You were systematic. You've ticked most of the boxes, actually. You know, you've ticked most of the boxes, which means that you knew how to manage cases. And we had to choose at the end between one of you. So, you know, but I think both of you did very well. You're very brave to be there and to be shown in front of all these crowds, okay, to show them how you're actually performing. And I really appreciate that, you know, you agreed to do that. And the same thing for the team yesterday and the team who's going to be there tomorrow. So please don't take it anything personal. And you did very well, both of you. Well done, all.
Tomorrow will be the showdown between the winners of yesterday and today.